Good evening all and welcome to March's public question and answer session. Introducing David Sherwood.
Thanks, Robin. I was going to say good afternoon, not good evening, but nice sunny afternoon here at Sherwood. So welcome to this. So I'm David Sherwood. I'm standing in for Richard Mitchell, who's currently off this week, and I'm joined by Julie Hogg, our chief nurse. Say hello, Julie.
Hi, everybody. Good evening.
Simon Barton, our chief operating officer.
Hi all, good to see you. Oh, no.
And Julie Lawton from Health Watch, who's going to ask all the tricky questions.
Hi everyone, and it's Jane Lawton, not Julie. Just
can't even read my writing here, Jane. Sorry.
Yeah.
So what I thought we'd do is we'd just give a little bit of a sort of situation update about how our hospitals are, and then I thought there's a few things we might explore, something around bringing back some of our services or increasing some of our services and the next steps with that. There's probably some questions that we might want to pick up about patients waiting for treatment and what we're doing about prioritizing that, and then something around perhaps what we're going to do with visiting them. And I'd just encourage you and ask you to ask us questions, and we'll try and endeavour to answer those as best we can, if that's all right. And Robin will be the moderator in that. So in terms of the activity in our hospital, so from this morning we had 29 COVID patients positive across our organisation. That was across the Kings Mills Hospital and Newark Hospital. Within the 29, only I think around 6 or so of those patients were within 14 days of being admitted, so what we might consider highly infectious. We've got 5 patients positive still sitting within our critical care unit, and our critical care unit is still acting as though it's acting within what we call surge capacity, so it's out with its normal estate because of the demand that it's having. But obviously that's dramatically different to how we were a month ago or so, when we had many more patients across the organisation, and it's completely different to where we were in January, when we peaked around 220 odd patients in the organisation. So a very different feel, I would say. Sadly, people still die with COVID in our hospitals, and so far it's around 554 patients who've lost their lives, very sadly. We've discharged, I think, around 1,476 patients or so. And just one of the fascinating statistics that sort of wakes me up is that we've just been through our first year anniversary of our first COVID positive patient, which was the 14th of March. And in those days, it took us about 3 or 4 days to get a swab back. We had to send it off to laboratories in Oxford initially, and then it gradually became closer and closer to Sherwood until we got our own assays working. And this week, we've just completed our 90,000th COVID swab, and that's what we've done in a whole year. So just a huge change. So it's been quite a busy time really for Sherwood. There's been some, amongst all that, there've been some other things that have been going on and happening, and I don't know if anyone recognises that. That's it's a slightly destroyed one, but it is an award that we picked up a couple of weeks ago now. This is the Health Service Journal, the preeminent journal for Health Service Journal Award for the winner of the Acute or Specialist Trust of the Year, and that's been awarded to Sherwood, and really proud to have that. And Richard gave a great acceptance speech about that, about how that reflected the hard work of all of our colleagues across the organisation. And I think that's a real testament to how Sherwood has pushed on and really driven the care of its patients over the last few years. So I'll stop there. And I just wondered, does anyone want to ask me any questions about any of those facts or figures that I've put out there, Robin?
There's no questions in the chat at the moment. I did wonder though, David, didn't touch on it really. Where are we in terms of vaccination as well?
Okay, so we still have the hospital hub vaccination going, and it's a real testament to what I describe as system working. So pulling from all different parts of the healthcare system across Nottinghamshire that we managed to run these vaccination centres. At the Sherwood hub, we've just vaccinated our 60,000th colleague or citizen through that. So that's a combination of obviously our patients, of our care home staff, our health and care staff, Sherwood staff, patients who are extremely clinically vulnerable, carers, all of those cohorts that you'll have seen talked about through cohorts 1 to 9. We're currently, there's developments in the vaccination hub. We now have both vaccines on site. So we have the Pfizer vaccine, which we're using for our second doses for colleagues and citizens who have that as their first dose, and then we have AstraZeneca that we're giving now as our first dose going forward, as we're likely to move into AstraZeneca being our primary vaccine supply. And just the booking of vaccination availabilities through the SwiftQueue portal. So I don't know if we put that out in the chat or anything, Robin.
We can put it in the chat, and we share it very regularly through our sort of social media channels, so people can find it there. So
obviously we're still doing this as per the joint committee on vaccinations and immunisations. So the cohorts, we're on cohorts 1 to 9 now. So that's the over 50s, health and caring staff, the clinically extremely vulnerable, carers, and obviously our Sherwood staff and other NOTS healthcare staff or any other health staff. I think the only thing I'd say about the hospital hub is that we think that we're going to continue with this program now. It's been a real success. There are obviously certain individuals who need to be vaccinated in an acute hospital, because we have a number of other facilities, and so we're looking to develop and make that hospital hub model more sustainable going forward, and we can update on that over the next few weeks or so. Any other questions, or shall I move us on to?
No, can we move on, Dave? Is that okay?
Yeah, of course. So Simon, just coming to you then, you sort of have the responsibility for the running, if you like, the services across the organisation and bringing back the services. So what's our plan to restore all of our services?
Thanks, Dave. So we've got to remember that we haven't, during this latest surge, we didn't stop any services. So some of them might have slowed down a little bit, but patients shouldn't have experienced any services stopping. That was very different to what we saw last spring. And throughout all of this winter period and all of this COVID surge period, we've been seeing about 80% of our previous outpatients work, and due to surge in critical care into theatres, about 40% of our theatre work. So we've been prioritising those patients on clinical need, and our clinicians have been given patients a sort of a risk number in terms of who gets treated first. So there's been a lot of work going on, and we haven't really stopped anything, but obviously it has slowed. So as COVID inpatient demand is reducing, we're obviously now starting to increase our work in terms of seeing more patients through our elective services. And there's been some sort of recent national guidance around that that's quite prescriptive. So During April, it says we've got to see 70% of the patient numbers that we saw in 2019-20, rising to 85% in July. We obviously committed to seeing as many patients as we possibly can, but it has to be safe. Social distancing remains in place in outpatients, and so we've got to make sure that even though the sort of prevalence of COVID is low at the moment, that we're not spreading infection around the hospitals. So it's got to be safe. We've got a plan to increase our theatre work, and by the end of April that'll be back nearer its normal operating levels. And we're working with our outpatient specialties to increase the number of patients that are seen in outpatients, but quite a lot of those patients are currently seen in a non-face-to-face way, and about 40%, and I think that's something that will continue. And our clinicians decide which patients they can and can't see in a face-to-face manner or via a virtual way. I think, and we'll probably touch on it a bit, but during the next few weeks, we're absolutely focused on all our colleagues within the organisation, being able to take some annual leave, being able to access some of the wellbeing support that's in place for them. There's lots of colleagues across the organisation who haven't had any annual leave over the past 4 to 6 months, and it's really important that they get a break. And therefore our theatre plan has a lot of focus on that, and sort of incrementally increases by the end of April. So I think by the end of April we'll be in a place where we'll be treating a lot more patients through theatres, and we'll be seeing, albeit some virtually, more patients through outpatients.
That's really helpful, really clear. And can I just ask a couple of points of clarification, Simon? So are patients who are waiting, for example, for operation, in terms of that prioritisation, we're doing that in conjunction or a similar way to NUH? So is it seamless across the system?
Yeah, so this is a national system around prioritisation. So clinicians across the NHS are prioritising who gets access to theatres, and that's done through a group of clinicians who meet every day and decide which patients are going to get onto the next theatre lists. So yeah. Same at Nottingham.
Yeah, and it's really important for me as a clinician that it's the clinical focus that is deciding that priority, because would I be right in saying, whilst we recognise that everyone is important, we recognise that some people have waited longer? Just because you've waited a really long time doesn't necessarily make you the most urgent.
Yeah, that's true. And there is sometimes a relationship between length of wait and urgency. So obviously your urgency can increase if you wait and wait and wait. But our clinicians are reviewing all of the patients on those waiting lists, and they will decide which patients need to come in soonest. Sometimes that's in conjunction with the patients themselves, because obviously you need patients to explain to you that their symptoms might have changed or things like that. So those clinicians sort of involve patients in some of those decisions.
And so it's not just for people waiting for operation. There are obviously people waiting for tests and things like that. And what's happening with our sort of diagnostics and our cancer pathways?
So our cancer pathway has been operating as per pre-COVID for many months now, and there aren't any delays around sort of like people getting their cancer treatment, and that's pretty similar to Nottingham. Quite a lot of the patients who are getting prioritised for theatre are cancer patients. In diagnostics, it's variable. So areas like imaging, where you get a scan or an ultrasound, they've been normal activity levels for many months. There are other areas, like if you're waiting for a cardiac echo, the wait is a bit longer there, and there's more work to do in those areas, and particularly there's work being done between ourselves and Nottingham about making sure that patients get their get the imaging or diagnostics that they need in as timely manner as possible.
Brilliant. Okay, I might bring in Jane, because I'm sure one of the things that people want to know about is around how we're keeping them informed and those sort of things. But Jane, any questions that you want to ask us or Simon on about the waiting lists or about the increasing activity?
Yes, thanks, Dave. I was just wondering so if you're a patient on a waiting list and you're wondering what's happening, you appreciate the fact that there are delays and you've heard it in the national media. How will you actually know what's happening to you at any one point in time, whether you're being discussed and whether you've now been put on a longer wait or a shorter wait? How's that information conveyed to patients?
So we wrote to all patients in October, sort of outlining the sort of waiting times and how long they might be expected to wait and what the process was for patients getting selected to get onto theatre lists. We will do that again. I think there is nothing that can beat getting a personalised letter that explains what is going on. So we'll expect to be doing that during April and writing out to all patients and sort of highlighting where they are. I think that's sort of as part of that process, patients to contact us if they're worried about their symptoms changing, and in that letter we'll identify a phone number that patients will be able to contact us on to be able to feed that back if they're worried about anything.
Does that answer that for you, Jane?
Yes, it does. I think that's helpful. I think it would be timely to do that now, because if you're waiting for something and you're in a lot of pain, October was quite a long time ago. Yeah. So I think that's really helpful that you're doing that. I mean, what we hear in the national is it sounds like you're perhaps doing better than some other hospitals on the amount of activity you've managed to continue to do. But the news is full of millions of people on waiting lists. And so can you give us a sense of how long waits are compared to everywhere else? I know it will vary by condition and so forth, but how far away is it from what the normal waits would be?
So, of course, Jane, it varies by what you've been referred in for. I think the waiting times have lengthened. They're over a year in some areas now. And so, you know, prior to COVID, we didn't have any patients waiting over a year. So I think we do see patients waiting over a year. That isn't across all specialties. But I think that you're right. I think we're generally doing more activity than a lot of other NHS organisations have done during this surge. We've got plans that to try and manage surges in a different way that will hopefully won't use our theatres as much, and we can continue to do more operating even if we see future COVID surges. But I come back to the fact that it's got to be safe, and what we've got to do is balance the risk to patients who are on our waiting list against the risk of cross-infection within the organisation. Social distancing is a big part of that. So I think we have got patients waiting over a year at the moment, and I think that we didn't have that pre-COVID, but I think it's something we'll also be able to recover from. But that's got to be done at the pace that our colleagues can do it at. And during April, there's a real focus of getting that balance right between them getting a bit of leave and then from the end of April really starting to increase our activity.
Okay, and just I'm going to take a couple of points from that discussion. So there's something that's really important, that a message for our patients who are waiting, that if their symptoms are changing, we want them to contact us. So if people have those real concerns, and then there's something also about recognise this isn't true for everyone, but I understand the frustration of waiting and all those sort of things. I'm trying to do a national directive where we're changing the terminology from waiting lists to preparation lists. There's something about giving our patients permission to actually take a bit of ownership and to get themselves in the best possible state that they possibly can. Now, that doesn't apply to everyone, but there is something about saying, look, there are things that you can do. There's something about exercise. There's something about thinking about the weight. There's something about the smoking habits, all of those sort of things. And it's easy for me to sit here and say that, but those make a real difference if you're coming in for an operation. And making some effort and putting that a little bit extra to try and give up smoking and all those things before your operation can really impact on your recovery. So it's putting that time to good use, I would say. And I'll stop lecturing there. Okay, I'm gonna move us on to Julie. Just thinking, Julie, around visiting. So we've followed sort of national guidance about visiting over the past all during the COVID pandemic, and it sort of ebbed and waned a little bit. Now that we're seeing less COVID in our communities and in our organisation, what are we planning to do with visiting across our hospitals?
Thanks, Dave. So we reviewed the visiting policy when the lockdown restrictions first started to ease. So we've gone from a very restricted policy. Where we're at the moment is for inpatients. The normal exemptions apply. So if the patient is end of life, requires a carer, or has a condition that requires a reasonable adjustment, those patients are allowed visitors. We're now allowing patients that have got that have an extended length of stay of 7 days or more to have a visitor 3 times a week, so that they benefit from that interaction as well. From an outpatient perspective, the restrictions remain as before, so we ask that people come on their own. We've got particular difficulty with social distancing in outpatients, so people come on their own unless they require a carer, or there is a reason they require a reasonable adjustment because of a condition they have, or if they are attending an appointment where they may get bad news, and the team will facilitate a visitor in those circumstances. Maternity visiting remains open across the antenatal pathway. We have some restrictions on the postnatal ward, and that's just around the timings that people can come, just so that we minimise the number of people on the ward at any one time. But birth partners are welcome throughout the antenatal, intrapartum and postnatal period. We're also offering lateral flow testing for birth partners from next week, and that will help us keep women and their babies even safer. We will review the visiting restrictions again on the 12th of April when the government guidelines change, and it's likely that we will move back to a designated visitor policy. So that's one visitor. It has to be the same visitor, but it's one visitor for 1 hour for each day. And we'll publish details of that because we need to stagger the times so that we don't have huge numbers of visitors in the ward environment. But we will announce that on the 12th if the government continue to lift the guidance in the way that they've planned. We're also rolling out the carers passport, and that will help us to support patients who need carers to really be active partners in patients' care rather than being a visitor. And our patient experience team have got further details on the carers passport if there's anybody observing who thinks they're eligible to obtain one, and that comes with various benefits that support them to be part of the patient's care.
That's great. That might be something that we want to drop into the chat or something as well, or into the comms. And just Julie, just before I bring Jane in to maybe ask any points of clarification, lateral flow test, what on earth's that?
Oh, so it's a quick test to test if you've got COVID. So it takes 30 minutes to get a result. It does mean you need to come to the hospital to have your test, wait somewhere around the hospital before you've had a negative test. If the test is negative, you're able to come in and be part of that pregnancy or labour journey. If the test is positive, we will ask you to go home and self-isolate in line with government guidelines. And
that's just for our maternity pathway?
It is just for our maternity pathway.
Lovely. Okay. Jane, was there any points of clarification and anything you wanted to ask Julie about that?
I think that was pretty clear, and it was good to know that it will be reviewed on the 12th of April, and presumably then beyond that, further at the next various stages of the easing of lockdown, if that goes according to schedule.
Yes, that's correct.
Lovely. Okay, Robin, any questions that we've got coming in?
Yeah, we've got a couple in the chat. Thank you, Dave. First of all, going back to the vaccinations, anonymously have asked. There's been a suggestion that older groups may be offered a booster in the autumn. Is there any guidance on that?
Shall I take that one? I haven't seen any national guidance as yet on that. I've heard various experts on the radio or the news updates saying this is likely, but I haven't seen any national guidance on it yet. I haven't seen what vaccine that might be. I suspect that this is targeted at the newer variants that we've started to see, particularly the South African variant, but I don't have any other update. Julie, I don't know if you've heard anything else on that.
No, afraid not. Nothing further to add.
But presumably, if that does happen, that's would strengthen our case to keep our vaccination centre open on the hospital hub.
Yeah, I think it's fair to say that we are prepared should we be asked to do that.
We do have another question. It's probably a Simon one. It goes back to the recovery, I think, from COVID, and they ask, even if we get back to 100% of pre-COVID treatment levels, that does not address the backlog. It just deals with the current demand. How long will it take to get back to the waiting lists we had pre-COVID?
Very difficult to answer how long that will take. The one thing I would say though is you've got to remember that during this period, primary care have referred in a lot less patients. So it's not sort of like get back to 100% and then we're just keeping up with normal demand. So if we were to do 100% of our 1920 activity in the next year and primary care continue to send us the referrals that they've sent us over the past year, we would see our backlog would start to fall. We're doing work with primary care to, so primary care is your GP in effect. We're doing work with primary care to understand why they sent less patients into us. Some of that will be that patients have found it more difficult to access their GP during COVID, but to try and get some of those things that GPs can do more in place and allow them to access more diagnostics and sort of change the way some of how we work. So I think we are being referred in less patients, and so therefore if we can get our activity higher, I think the backlogs will start to come down. How long it's going to take to get back to pre-COVID levels is I couldn't answer that accurately at this moment in time. I think the focus over the next quarter has got to be on just treating more and more patients day after day after day who are on that waiting list, and then we'll see where we are after that first quarter, so to the end of June.
Okay, thank you. Dave, are you all right if I carry on with another question we've had in advance?
Sure.
Okay, thank you. So this came in on email, asking around new guidance around car parking charges. So it's coming from Deborah, who says, can I put a question forward relation to car parking charges in NHS England from the 1st of April, or from April? And this is about individuals that attend hospital more than 3 times a month for 3 months. And the guidance says that they won't have to pay car parking charges. And looking for clarification on what our plans are around that.
I can take that.
So, oh, that's perfect, because I was going to say Richard is our car parking expert and he's not here. Go on, Julie.
So I think it's fair to say that this is not straightforward to implement. We've got a team looking at it from estates and facilities and from patient experience to try and make sure that we can meet this guidance, and they're working on it urgently. We are committed to implementing it, but I think it's fair to say it won't be in place on the 1st of April, but we will find a way for patients to be refunded for any payments that they've made that we subsequently change. So it's not straightforward because of the barriers and how we send out free passes to patients, but we are working through it, and we'll find the most pragmatic way forward that makes it easiest for our patients. And I'm sure we'll have some comms coming out in that in the next week or so on that.
That's great. Thanks, Julie.
Brilliant. So there's just one other topic I was going to pick up. That was something about how our staff are feeling, if you like, and the sort of general mood of the organisation. I don't know what your thoughts, Simon or Julie, were on that. You've touched on it quite a bit, Simon, in talking about that balance between bringing back activity and ensuring that people have had some rest and recuperation, bearing in mind they've been through probably the worst winter in NHS history. So any other thoughts on looking after our staff and supporting them through this?
Yeah, so I think as we've discussed, the opportunity to have some time away from work is important for them. I think the opportunity to do their normal jobs. So you have to remember that a lot of colleagues within the organisation have been working in areas that may have been a year ago unfamiliar to them. They're probably a lot more familiar now, but may have been unfamiliar, and therefore they'll be going back to their sort of like normal day job, for want of a better word, although many of them working nights, obviously. So I think that's I think those things are important for them to get into a sort of more normal operating and get some annual leave. But I think you have to, they're also people who live in the community as well, and I think they're looking forward to the release of restrictions. They're looking forward to being able to socialise with friends, socialise with family, go to the pub, all those things that sort of like, people across the UK are looking forward to in terms of the easing of restrictions. So I think they're keen to see that as well. I think they're quite optimistic for the future. I think they've been, we're all sort of like proud of the work the vaccine programme has done and seeing that as a potential sort of hope for the future, but cautiously optimistic around that. But so I think getting some rest though is an absolute priority for them. That's what they tell me.
Julie, any thoughts from your side?
I think I'd echo what Simon's said. Really, it's about people going back to their normal place of work, taking some leave, starting to think about their own personal development as well. So there's very little personal development that's gone on over the last year. So we're looking at what opportunities we have available to staff so they can start and think about their own professional development, because we know if we get that right for them, then we get it right for patients as well. So I'm sure we're all hoping for a little bit of normality. And
Jane, I just recognise I've just asked you a question for you, but any thoughts from you about how our staff are feeling, or what we can do to support them?
I'd be interested to know what the toll has been on the staff in terms of their mental health. So again, this is something you see quite a lot in the news, is people saying they can't carry on, they're going to leave the NHS. How well have they actually coped, those who've been through this? Are people leaving, or are they actually thinking that with a bit of time off they will be able to recover? Is that all they need?
Julie, do you want to pick that up?
So I think the teams have coped phenomenally well. There's no doubt that some people have been very, very affected by this and have had to take time out. There are others that have been less affected. I think we don't understand the full extent of this yet, and we may well not know for some time. I haven't personally at Sherwood, I don't think we've seen lots of people leaving the organisation. We do have a steady trickle of people leaving. I think it's smaller here than it is elsewhere, but I think we won't really understand the true impact on the mental health of the workforce and attrition within the NHS for some months and maybe years yet. On a positive note, you know, applications to do nurse training have increased significantly. I think I saw somewhere it's applications are up by 30,000 or something phenomenal. And we have Nottingham Trent University working with us here to offer nurse training opportunities for our local community as well. And those opportunities will be going live very soon. So I think whilst it has been a very bleak year, it does look very hopeful for the future in terms of attracting people into the NHS. And that's not to underplay the impact that it's had on staff, because we absolutely realise that some people have been very adversely affected. And it's our job to make sure that they get the support that they need, and we're doing everything that we can to make sure that they do get that support.
And I just, you know, I think all of our staff are exactly the same as everyone else in our communities. They just hope that this is the end of it all, and they can see some light at the end of the tunnel. And that will be the best thing that can possibly happen. But we just don't know that yet, I guess. Okay, how are we doing for time, Robin?
We've got about 5 minutes on the clock, Dave, but we've got no more questions in the chat.
I've got one more thing to just highlight. I don't know who to ask this to, but I've read in those press releases that our chair, John McDonald's, going on a secondment to Leicester. So what's all that about, and how could he possibly leave an organisation that has this?
That's the question for John McDonald, Dave. So, Claire Ward, one of our or our deputy chair, is going to step up and be chair. So that's I think that's a really positive step for Sherwood in his absence. But it's, as I say, it's a secondment for John going off to support Leicester. Okay. Any other questions, Robin, or should we draw it to a close?
I think that's the natural point to close it, please, Dave.
Perfect. Well, can I just say any final reflections from you, Jane? And
I think it feels a bit more positive, which is good. It feels like, you know, things are starting to move in the right direction, which is really, really positive, and we've all just got to be patient. And wait for that activity to pick up, and yeah, so I think positive signs. That's good to hear.
Thank you, Simon. Any last thoughts?
Yeah, I think I'm sort of you know, with the vaccine programme, and hopefully that will be successful. I'm sort of cautiously optimistic about the next 6 months, and being able to really treat more elective patients. So yeah, I think there's a lot of hope for the future, and let's hope next time we do one of these we remain in an even more positive place.
Yeah. Julie, anything from you?
Yeah, I think it's just to echo that, and a reminder that we all have a collective responsibility to continue to follow the rules. So the lockdown's easing. It may not be at the pace we'd all want, but I'd urge people to take collective responsibility for following those, so that we do have the summer that we'd want to have, and just to wish everybody a nice bank holiday weekend. Thank you.
Robin, anything from you finally?
Thank you, Dave. Yeah, I guess it's just similar, really. It's been a long, hard slog since January, but it's a big thank you really to the community, because the pressures have reduced massively in terms of sort of the number of COVID patients, and that's only happened because people have followed the rules. And I know it's been difficult, and I know it's been challenging, and hopefully, you know, we're rolling into Easter. The weather's getting better, and a bit like Julie said, hopefully it's a more positive time moving forward.
there is something about it getting lighter in the evenings and lighter when we come to work and those sort of things, and spring and all of those sort of things that does just raise our hopes a bit. Although I hear it's going to snow over the bank holiday. But with that, I'll say thank you all. Thank you to all of my colleagues. Thank you to Jane, and we wish you a peaceful, safe, quiet Easter bank holiday.
Thanks, Dave.
Thank you.
Take care.
Thank you.